This video is for educational purposes only and does not replace official training, local protocols, or medical advice. Always follow your specific agency guidelines and medical control. What triggers a seizure? Seizures can happen for a bunch of different reasons related to brain stress, medical issues, or chemical imbalances. Common causes include withdrawal, alcohol, ETOH, withdrawal or medication withdrawal, brain and head issues, strokes, head injuries, or brain tumors, metabolic/body problems, low blood sugar, hypoglycemia, high fever, infections, or sepsis, chemical factors, toxin or drug overdoses, or eclampsia, a severe blood pressure condition during pregnancy. The two main categories. Seizures are generally split into two main buckets: generalized, affecting the whole brain, and partial, starting in a specific spot, though they can sometimes spread and become generalized. 1. Generalized seizures. These affect both sides of the brain and come in four main types. Absence, petit mal, usually seen in kids ages 4 to 12. It causes a brief loss of consciousness, but the person keeps their posture. There is no postictal recovery phase. They just snap right back to normal, though they might develop grand mal seizures later in life. Atonic, drop attacks, a sudden collapse because the body loses all muscle tone and posture. Because of the risk of falling, people with these might wear a helmet. Myoclonic involves brief muscle contractions on both sides of the body. Tonic-Clonic, grand mal, the classic seizure most people picture. They often start with an aura, a warning sign or sensation, a loss of consciousness, and a loss of muscle control. They happen in distinct phases. Tonic phase lasts for seconds. The muscles stiffen up, and breathing temporarily stops. Apnea. Things like tongue biting and urinary incontinence can happen here, though not always. Clonic phase lasts for minutes. Rhythmic cycles of muscle rigidity alternating with relaxation. Postictal phase, the recovery period where the person wakes up. They might be unresponsive for a moment, totally confused, super tired, fatigued, or even combative and embarrassed. 2. Partial focal seizures. These start in a specific, identifiable location in the brain and are broken down into two types. Simple partial movement or clonic activity is isolated to just one body part. Under the sensory subtype, the person might experience strange smells, tastes, visual disturbances, or numbness, typically without losing consciousness. Complex partial usually affects the temporal lobe of the brain. It starts with an aura, lasts about 60 seconds, and involves signs and symptoms like a loss of consciousness, lip smacking, chewing, or swallowing. What responders do? BLS interventions. If someone is having a seizure, emergency providers follow a specific protocol to keep them safe. 1. Safety first. Clear away surrounding objects so the person doesn't get hurt hitting things. 2. Vitals and checks. Check pulse oximetry, oxygen levels, and blood glucose (CBG). 3. Airway management. Place the patient in the recovery position, left lateral, and use suction if their airway needs clearing. 4. Call for advanced help. ALS call for advanced life support providers who can administer medications, though starting an IV during a seizure can be really difficult, so they might use IM meds. 5. Gather history. Ask important questions like, when was their last seizure? How long has this one lasted? Are they compliant with their medications? Or have there been any recent changes or missed doses? When paramedics step up from basic care to advanced life support, ALS, during a medical emergency like a seizure, they bring out the heavy-duty tools, medications, and deeper diagnostic skills. Here is how an ALS assessment and intervention process works, broken down step by step. Phase 1. The ALS assessment. While basic life support focuses heavily on keeping the patient safe and breathing, an ALS provider digs into why the seizure is happening and checks the body's internal stability using specialized tools. Vitals and monitoring. Beyond basic oxygen checks, ALS providers hook the patient up to a cardiac monitor to watch their heart rhythm, since severe stress or certain toxins can mess with the heart, and check continuous blood pressure. Check blood glucose, CBG, or BGL. Low blood sugar is a major trigger for seizures. Paramedics test blood sugar immediately because fixing low blood sugar can stop a seizure instantly. Targeted neurological exam. They look closely at pupil sizes, eye movements, level of consciousness, using scales like the Glasgow Coma Scale, and check for any focal deficits, signs that a specific part of the brain was damaged or stroked. Detailed history gathering, they interview family or bystanders to pin down critical timeline details. How long has a specific seizure lasted? If a seizure lasts longer than 5 minutes, it's treated as status epilepticus, a dangerous emergency where the brain stays stuck in seizure mode. Is there a history of epilepsy, missed medications, or sudden changes in health? Could drugs, alcohol withdrawal, or toxins be involved? Phase 2. Advanced interventions. If a seizure won't stop on its own, or if the patient's body is crashing, ALS providers step in with advanced medical treatments. Stopping the seizure, anticonvulsant medications. The primary ALS weapon to stop a prolonged seizure is a class of medications called benzodiazepines, like lorazepam or midazolam. Paramedics try to start an IV, intravenous line, to give these meds directly into the bloodstream. However, because a seizing patient is thrashing around, getting an IV can be extremely difficult. If they can't get an IV going quickly, they can give the medications through alternative routes, such as IM, intramuscular, shots into a muscle, intranasally IN, atomized up the nose, or buccally dissolved in the cheek. Advanced airway management. Seizures hog oxygen and cause the body to struggle with breathing. ALS crews provide high-flow oxygen, and if the patient completely loses the ability to breathe on their own or protect their airway, paramedics can use advanced airway equipment, like inserting a supraglottic airway or endotracheal intubation, to breathe for them. Fluid resuscitation and correction. If the patient's blood pressure drops, or if they are dehydrated or showing signs of shock, paramedics will run IV fluids. If a low blood sugar level caused the issue, they will deliver intravenous glucose, like D10, to feed the brain.